The third most common mental health disorder after depression and substance abuse, social phobia, is an anxiety disorder involving intense distress in response to public situations. Individuals with social phobia typically experience symptoms resembling panic during a social encounter. These situations may include speaking in public, using public restrooms, eating with other people, or engaging in social contact in general. Persons with this disorder fear being humiliated or embarrassed in social and performance situations by their actions and may become intensely anxious with an increased heart rate and other signs of autonomic arousal. The onset of social phobia may or may not be abrupt, often manifesting after a stressor or humiliating social experience in an individual with a childhood history of excessive shyness or social inhibition. Social phobia is considered a disorder if it is severe enough to adversely affect social or occupational functioning. That is, individuals with true social phobia go to great lengths to avoid social situations, usually to their own detriment. The fear of embarrassment is ego-dystonic, and persons with social phobia are distressed by their symptoms.
Clients with social phobia usually fear the performance or fear of performance in front of certain population. Such fear is originated from the fear of being humiliated, of being under observation of others. And this fear actually causes significant distress and usually interfere with their quality of performance in a lot of social situations, whether occupational situations or social situations. So clients with social phobia usually refer to a psychiatrist for evaluation because of their avoidance of performance or the tremendous stress actually that they endure during their presence in certain social situations.
Social anxiety is the way of describing an extreme form of shyness. When somebody's very shy, they avoid social situations, they feel very uncomfortable in social situations, they feel very anxious. But social anxiety is different from shyness. It's more than just shyness. Shyness won't necessarily stop someone from going out of their home, whereas social anxiety will. Somebody who's socially anxious will be so fearful of social situations. Their fear and their anxiety is mostly based around the idea that they're going to be judged negatively by people around them. They'll think that people will be paying very close attention to their behaviour and their appearance and how they're in the social situation. So they might worry that someone or the people around them are very or noticing how they might be blushing or shaking and trembling because they're feeling so anxious. And whereas an ordinary person might be able to get through this and shake it off, somebody who's socially anxious will actually stop them going out to social functions. They'd rather stay at home because there is the fear of what might happen, what people might think about them, prevents them from going out. Social anxiety can have a big effect on other aspects of your life as well.
Social anxiety, it's some sort of anxiety disorders. Anxiety disorders, it's a spectrum, by the way. A spectrum, it's mean a domain which include several disease or several illness, such as phobia. And phobia including not less than 51 of phobic, such as agoraphobia, the fear of feeling of fear from places, or claustrophobia, and social phobia, and darkness phobia, and natural phobia. So we have a lot of, or planophobia, by the way, or flight phobia, that the person who afraid to get into plane and to travel, by the way. And we have social anxiety or social phobia. Social phobia, it means that the patient cannot communicate with people around him in social situations.
The prevalence of social phobia is estimated to be between 3 to 16% of other types of phobia. So social phobia actually cause or occupy on the top of all types of phobia. The prevalence, such a prevalence actually is considered to be high among other types of phobia or other types of anxiety disorders in general.
Social anxiety or social phobia is the most common anxiety disorder and is the most common anxiety disorder in Saudi Arabia.
The prevalence of the social phobia or social anxiety disorder is quite high, and research has found in the Western communities that it might reach up to 11%, which is quite high. There are no clear statistics here in the Middle East or in Saudi Arabia, but I would imagine that the prevalence is quite high, as we see a lot of patients present to us in the clinic with social anxiety or social phobia. So it's quite high, and it's quite prevalent in our community. When comparing males to females in social phobia, in the Western communities they found that there is no clear differences between the two genders, that the male to female is actually quite the same. Further research, of course, is required to find more epidemiological data in terms of the social phobia, especially here in the Middle East and in Saudi Arabia, but it's clearly common, and it needs to be addressed, and it needs to be treated, so it's quite high.
At the age of 13 years old, we can diagnose patient who suffering from social anxiety or social phobia. Other studies started to focus that 75% of individuals have the social anxiety or suffering from social anxiety between the age of 8 years old and 15 years old. And this is a very important result.
Emotional symptoms of social anxiety disorder, social phobia, excessive self-consciousness, and anxiety in everyday social situations, intense worry for days, weeks, or even months before an upcoming social situation, extreme fear of being watched or judged by others. Especially people you don't know fear that you will act in ways that will embarrass or humiliate yourself, fear that others will notice that you are nervous. Physical symptoms of social anxiety disorder, social phobia, red face or blushing, shortness of breath, upset stomach, nausea, trembling or shaking, racing heart or tightness in chest, sweating or hot flashes, feeling dizzy or faint. Behavioral symptoms of social anxiety disorder, social phobia, avoiding social situations to a degree that limits your activities or disrupts your life, staying quiet or hiding in the background in order to escape notice and embarrassment. A need to always bring a body along with you wherever you go, drinking before social situations in order to soothe your nerves.
Social anxiety is having a bad negative impact on your life. It might be preventing you from succeeding. It might be preventing you from taking part in activities that you would enjoy. So like for work, for instance, you might find that the person is not succeeding as well as their ability says they should. They might not be getting the promotions, they might not be doing the range of work they could do, and that's because their anxiety about social situations is making them just want to avoid anyone noticing them and avoid putting themselves forward for any kind of work that may trigger off those fearful symptoms, those fearful reactions. So for instance, like public speaking or having to give a presentation, things where they know that people's attention will be on them.
He see himself that he cannot communicate, or he has no skills to communicate or to qualify him to communicate with people around him. Another thing that we can note in people who are suffering from social phobia, that they have or induced some sign or symptoms during presentation or during social communication skills. One of them is stuttering and oversweeting, or hand shaking, or palpitations, or high heart rate. Another thing you can note in people who are suffering from social phobia, that the social phobia be significant shows at interview, a specific occupational interview or work interviews. When they started to communicate with authorization people with authorization, like officers or like ministers or manager, you can note some sort of hesitation during communication, stuttering or hand shaking, and he cannot communicate in a good way. Signs and symptoms deviated in two ways. One of them is psychological symptoms, and another one of them is physiological symptoms. Psychological symptoms, you can find that patient who's suffering from anxiety in general or social phobia in specific, that they have distraction of attention, poor self-esteem and poor self-confidence, poor social communication and social presentation skills. By the way, you can find very significant impairment in his verbal communication skills, and his body language started to be down towards the ground or towards the earth. You may find the patient who's suffering from social anxiety or social phobia with his shoulder down and his face and poor eye-to-eye contact. This is a very important psychological symptoms. Another physiological symptoms, as I mentioned before, that he oversweeting, stuttering during speech, and hand shaking, and impulsive and over heart rate.
There is certain diagnostic criteria actually for social phobia. The first important one is there should be a marked and persistent fear of performance in certain social situations. Such fear originates from the fear of being humiliated or under observation of others, and such fear should interfere with their actually performance or their presence in such social situations. Clients also should recognize that such fear is excessive or unreasonable, or there is no logical basis of such fear, and such fear, as I mentioned before, cause avoidance of such situations. The avoidance, or they can endure such situations with a great deal of anxiety. This anxiety actually is usually observed and it's usually noticed by others. And such anxiety also interfere with their way of communication with others.
Is disorder characterized by anxiety symptoms appearing or person with social phobia complaining or suffering from an anxiety symptom as sense of suffocation, tachycardia, increased heartbeats, tingling, sweating, fainting, dizziness, abdominal pain, vomiting, when interact with other people, in social interaction, in social communications.
Symptoms of anxiety, social phobia is defined as symptoms of anxiety, psychological or autonomic, that is not secondary delusional, not secondary obsessional, and restricted to certain places or certain situations, which clients usually feel under observation of others. This issue causes avoidance or impairment of performance in such kind of conditions. For the functional consequences of social phobia, as we said before, this condition may prevent clients from performance in the daily social situations. It may prevent them from performing in appropriate way in their work, in their social activities, and usually it causes marked stress for clients, and usually clients comes or present to the psychiatric clinics for the evaluation of this condition because of its severe functional consequences.
Inherited traits, anxiety disorder, tend to run in families. However, it isn't entirely clear how much of this may be due to genetics and how much is due to learned behavior. Brain structure. A structure in the brain called amygdala may play a role in controlling the fear response. People who have an overactive amygdala may have a heightened fear response, causing increased anxiety in social situations. Environment. Social anxiety disorder may be a learned behavior. That is, you may develop the condition after witnessing the anxious behavior of others. In addition, there may be an association between social anxiety disorder and parents who are more controlling or protective of their children.
The problem in the signs and symptomatology of social anxiety disorder, or social phobia, as some like to call it, that sometimes that patient with social phobia is so respected in some societies. Although he's suffering a lot, how so respected? That he's so polite, so quiet person, he's not interrupting others, he's not interfering during talk, because usually in that societies they're talking much, interrupting others, interfering with others while they are talking. But the patient from inside, he's suffering, that he's feeling that he can't talk in front of others. What happens when he under the focus and attention of others? He feels so shaky, palpitation, sweating, dryness of the mouth, and he feels that he can't continue and he can't talk. If he's standing, he can't keep standing. He's trying to avoid the eye contact as he can. The issue now in the signs and symptoms of that disorder, sometimes I have told you that he be so respected by others, but he's suffering from inside. Sometimes that person will change his form of life or his situation in one way or another to suit to his social anxiety disorder, not to affect him because he won't want to look for medication. Sometimes no, he don't think that he is mentally ill or having a psychiatric disorder, then he will readjust his life according to his situation. If he's, for example, a teacher or working in public relationships or something, some forms of type of that work, he will change his work to be not in front of others, and gradually he thinks that avoiding others is very important because nothing good to deal with people. He will rationalize for himself the presentation or the symptoms he is having, because most of them he don't know that there's something called social anxiety disorder.
Persons with social phobia usually have a history of other anxiety disorders, mood disorders, substance-induced disorders, and there is a certain high comorbidity actually among patients with social phobia. For example, substance-induced disorders are on top of such comorbidities. Major depressive disorder, other type of anxieties are also considered to be on the top comorbid or on the top comorbidity of patients with social phobia.
Causes of social phobia or social anxiety disorder variable from social culture causes and social experiences and biological or neurochemical transmitters as dopamine, norepinephrine, and serotonin, and social experience and drug-induced social phobia as alcohol or maybe withdrawal from hypnotic as benzodiazepine.
The most common in social anxiety or social phobia that there is 7% at the United States of America suffering from social anxiety. And the other countries between the percentage between 2.0 and 2.3% at the other countries, especially by the way, Gulf countries. The risk and the prognostic factors of social anxiety or social phobia may include 3 factors. One of them temperamental, and the other one environmental, and the other one genetic and physiological. If you can make a balance between the other factors, we can find that there is biopsychosocial factors in social anxiety. One of them, the disturbance in endocrine system, may include social and anxiety, by the way. Another one, the way of thinking in the patient who's suffering from social anxiety. Another factors, the way of dealing with the child and dealing with adolescent in the family dynamic, interactive with his parent and siblings, may induce social anxiety at the age of adolescent between 8 to 15 years old, and also may induce general anxiety disorders.
Usually the prognostic feature depends on a lot of criteria or a lot of factors. Like, for example, early onset of the symptoms will lead to good prognostic factor. Female tend to have less severe symptoms than the male. Also, if they have what we call high level of functioning and education and something like that, they will have what we call good prognostic profile in the future. Another thing, if they have what we call short duration of the illness. Usually if they have short duration of the illness, and if we interfere at the beginning of the illness, we will expect good prognosis in the future.
Pharmacotherapy, SSRIs, serotonin norepinephrine reuptake inhibitors such as venlafaxine, clonidine. Cognitive therapy has evidence-based efficacy. Behavioral psychotherapies such as gradual desensitization, specific CBTs, cognitive and insight-oriented therapy, group psychodynamic psychotherapy, and individual psychoanalytic psychotherapy.
To assess people who are suffering from an anxiety disorder, one important assessment tools is Teller assessment tools to assess an anxiety disorders, a specific social phobia. One important thing to make cognitive behavior therapy, it's to make a communication and the correlation relationship between muscles relaxation and negative situations that person or a patient suffering from anxiety. How come? He has to write down the negative situation or the social phobic situation, and then during the social situation he started to imagine himself that he able to relieve himself from anxiety and able to face people around by self-assertiveness. Self-assertiveness, it's mean how to communicate with people in a right way and in a positive way without any negative or humiliation tendency or behavior or inappropriate behavior. In America, they make a very simple definition of self-assertiveness. It's mean how to say no to enhance your right in social situation and how to accept other people's opinion even if they refused your point of view or even if it is not consistent with your point of view. This is a pattern of self-assertiveness and how to accept the criticism in a positive way.
There are certain psychotherapeutic and pharmacological modalities actually for treating social phobia. The approach actually stands on two major dimensions, the psychological point of view as well as the pharmacological point of view. Actually, the antidepressants, specifically the selective serotonin reuptake inhibitors, are considered to be the most important agents for treating clients with social phobia. Of course, clients should be also evaluated for the presence of other comorbidities. Other comorbidities should be treated, and patients also should be rehabilitated because such illness usually cause tremendous anxiety and it usually interferes with the lifestyle of clients. So the pharmacological and the psychological interventions should go in parallel, should go at the same time, because clients should be taught the way of thinking in a positive way. They should be directed to the way of raising their self-esteem, and pharmacological interventions will give them the appropriate base for such interventions.
Now, the social anxiety or the social phobia might have a severe negative consequence or impact on the individual who has the disorder. For example, it might prevent the individual from moving into his career or achieving higher social status because of this disorder. For example, let's say that there's a researcher or an individual who's making research and who's going for his doctorate degree. He could not achieve that if, for example, he could not present his research to others because the social phobia might prevent him from presenting his work to others, and hence this might prevent his career to go on forward or to achieve further into his career. The same goes for any individual who has academics or schooling, or even in his work. If he has social phobia, this phobia might prevent him from moving forward. So this might have a negative impact generally in the patient's achievements and in his career. Other negative consequences of social phobia that they might have or might develop later on depressive features or a depressive episode because of this phobia. Because of the phobia, because this social phobia prevents them from achieving certain goals or socializing with others, they might feel inferior to others, and so their self-esteem become damaged, and so they will develop low mood and they become depressed, and this might complicate the issue even further. So definitely the social anxiety disorder needs to be treated, because the negative consequences of such a disorder are devastating to the individual and might interfere with his career and his function. So they have to be treated.
As a therapist, check what the specific situation is that they're most worried about, and then go through that as what they would call like an exposure therapy within the therapy setting itself, help someone practice how they would react, or practice and think through what people might be thinking about them if they were shaking, and try and get them to think about other things. So for instance, if someone thought that people were going to notice that they were holding their cup and shaking a lot, you perhaps have a cup in front of you during the therapy and talk through what that might feel like, what the other person might be thinking, to get the person used to the situation and realise that the worst that they think is going to happen isn't going to happen. So often that can be when you've got anxious kind of thinking, you think about the worst case scenario, you think about the worst thing that's going to happen, and that is the fear, and that's what prevents you from doing certain things. But when you practice that situation in a safe environment like therapy, you realise that actually the worst is not going to happen, and you can manage your anxiety and your fear. And therapy will also help you with coping strategies to deal with fear and anxiety. Typically you would help someone start with that by teaching them some relaxation techniques. There are many forms of relaxation. You can start with simple breathing exercises, focusing on the pattern of your breathing, just take a few minutes to do that. Or you can work on what they call progressive muscle relaxation, and you go through the different set of muscles in your body and focus on relaxing them. You can do mental imagery, think about a scene that you find very relaxing, somewhere that you've found very safe in the past, and go through that in your mind. And one of the things that's very useful when you're relaxing using mental imagery is to try and think about all the senses, all your senses, and how you can incorporate that into the relaxation. So you think about the situation, the scenario that you're imagining, and you think about the sounds that you might be experiencing, what you're seeing, the vivid colours, the smells, the touch, the feeling of that, the taste, all those sort of things. So you involve all your senses, and what you're doing there is you're diverting your brain's attention away from the anxiety-provoking situation, and you're trying to create more of a sense of relaxation within your body. So that's one of the simple techniques that you can do, along with, again, cognitive behavioural therapy, looking at some of the thoughts that you've got, the automatic thoughts you've got, that's making you avoid certain situations and letting your anxiety take over and preventing you from doing things that you could be enjoying and doing things that could help you progress in your life.